Good afternoon and welcome back. Let's go ahead and get started. So we have 4 weeks left in the term. We're definitely getting really close to the end here. So we are going to build off of some of the things that you all brought up in your presentations last week. As we start to talk about health and science communication and the relationships that these issues have to policy. So last week, on Monday and Wednesday, we heard from your presentations. Just as a reminder, if you haven't done so already, please make sure to submit last week's quiz that asks you to look at 3 presentations and just share your thoughts about how we have identified and addressed a health disparity and communication strategies related to those. I was really impressed, again, as I mentioned, with the array of presentations that you all had in terms of topics and issues that you selected. There was a really great range of incredibly important contemporary issues, in talking about Indigenous rights and access to healthcare, in talking about ethnic minorities and access to things such as health literacy and other information like that. And so there's a great range of topics, and also how you all were able to identify communication strategies to deal with those topics. So I will have your grades and feedback up on this assignment by the end of this week. And we will be hearing from one more presentation on Wednesday that wasn't able to be presented last week. So we'll hear a little bit more. But again, I really appreciated your engagement with these topics and attention to detail in working through those presentations. So as we go into this week, we are shifting gears to really talk about policy issues. And we're doing so in a couple different areas. Between the two chapters I'm asking you to look at, and a very, very short piece that's talking about how to educate and engage on policy issues in health and science communication. And the two prongs that we'll be looking at relate to, first of all, what does it mean to work within a health organization, administration, or similar group that's responsible for providing health care and directing policy? And second of all, what does that look like when we're managing issues of healthcare reform and similar crises, which of course have been incredibly relevant in the context of COVID-19 and similar issues. So we'll be looking at those and thinking about how a lot of current events and issues, including COVID-19, have impacted the ways that we communicate about health and science. And this is important to a lot of us who might be thinking about and working toward careers involved in health, and also to people that are just interested in trying to understand and make sense how we talk about those issues in an organizational context. So I will be posting later this week the full rubric and guidelines for this assignment, but I do want to put on your radar that the final major assignment that you'll be completing for this class is a health and science campaign essay. You'll also find that the description of this assignment is available in the course syllabus. So I'd like to take a moment to talk about this in a little bit more detail. But this is building off of the work that we've been doing over the course of the term. And now that you've started to think about how to address disparities and to create communication strategies, what I'd like you to do for this last assignment by June 11th is to pick an example of a health or science campaign that attempts to reach and engage the public and to really assess its communication strategies and efforts and some of the ways in which this campaign has communicated about health and science to the public. So there's a lot of different examples that you could think about or draw from. One might be ACT UP, about HIV/AIDS support, research, training, and awareness. Another was the DARE campaign related to drug use and similar issues, right? There are a lot of different campaigns that have addressed and tried to promote issues of health. So I'm asking you to really kind of unpack how they use communication to discuss and relate those issues. So just to, again, give you a little bit of a preview on what I'm looking for this assignment. I know it's about a month out, but I do want to give you plenty of time to think about and to plan for this one. So this assignment asks you to pick health and science campaign, explain what that campaign is, its audience, and how it conveys health and science information, and then analyze the communication in terms of its messaging, cultural representation, what cultures or groups is it trying to target, what relationship does this campaign have to institutions? For example, is this coming out of like the CDC or similar organization, and anything else that's important. How this campaign communicates and how effective it is in communicating to its audience, something I'm asking you to use. And then I'm also asking you to look at least 3 outside scholarly sources. You could draw from ones in your annotated bibliography if they're relevant, or pick new ones. It'd be 4 to 5 pages, double space, standard font, and margins. So just know that that's coming up as your last major assignment for this class in assessing and thinking about this campaign. As you're starting to think about this, we do have next week, we'll be really looking at campaigns and public efforts to communicate about health and science. So there'll be a lot that you can draw from for that assignment from next week, as well as this week's discussion on policy issues. So we'll be looking at some of that stuff for next week. During week 9, we are only meeting on Monday. We'll be talking about gender in health and science. We will not have a class meeting on Wednesday, May 25th. I will be presenting research at a conference in Paris, so I will not be in town. Oh, yeah. Thank you. Yeah, it's International Communication Association, and It's a presentation that I'll be doing about some of the ways in which we deal with and communicate about stigma and efforts to navigate stigma in healthcare. So looking forward to that. Thanks. Yeah.
Are you going with like a group or is it just you?
It's just my partner and I. So we're looking forward to it. Yeah. We've got Memorial Day, and then June 1st will just be our last class. We'll talk a little bit about health, science, and disability. And then we don't have a formal class meeting on finals week because I know a lot of people are already out of town by then and have a lot going on. Some of you might be graduating, which is very exciting. But I will ask that you turn in that essay by the 11th, and I'll be posting an extra credit opportunity for you as well. All right, so wanted to give you those last 4 weeks at a glance. Any questions before we get started on stuff for today? Cool. All right, so today, in thinking about health and science policy, right, there are a lot of things that have come up that make this a really important thing to talk about, right? First of all, your presentations, we're looking at a lot of really major policy issues. For example, thinking back to Justice's presentation about the ways in which obesity discussion and campaigns are not super effective, right? Or thinking about issues of class, poverty, and financial barriers in terms of providing support to people who are diabetic, right? As folks such as Garrett brought to the table as well. So there are a lot of really major issues that are continuing to impact us in health issues, and I think understanding some of the policy implications is important. As we have seen all over the news over the past several days, we know that there was a leaked document related to a draft that would overturn Roe v. Wade in the United States and drastically change the landscape of abortion and the legality of abortion in the United States. In fact, there are several states in the US that have what are known as trigger laws, which mean that if Roe v. Wade is overturned, that those states would automatically ban abortion. Other states have the opposite in effect, where abortion is sort of protected in its legality immediately if this were to take place. And a lot of states that are kind of in between or have some kind of inconsistent elements there, right? So a lot of questions related to when/if this change is actually going to happen and how it impacts, of course, abortion and other kind of reproductive health related topics more broadly. So this is huge, right, in terms of how it impacts health and related policy issues, right? Regardless of your personal opinion on the topic of abortion and similar types of issues, it's a major thing that has come up and drastically will change the way that we think about health and related issues. We've also, of course, seen over these past 2 years, COVID-19, the impacts that it's had on policy, including masking, vaccination, social distancing, and other public measures, right? And the impact and legacy of those policies. And again, a lot of other major health changes and issues, including developments, science, medicine, technology, and some of the continued ethical challenges that we face related to those. So when we think about how we engage with policy issues, right? We teach a course in communication that's organizational comm, right? Which looks at how the structured groups, organizations, nonprofits, and so on communicate. Leadership communication looks at this in a similar way. And these are really connected, right? Because you might already be involved with the organization of the group that communicates about health or science issues. You might be involved in one in the future. And if you're not, understanding how some of these groups or organizations communicate is important to understand the broader context of public health and related issues. So I'd like to use some examples, applications, and ways of thinking about some of these topics to get us thinking about the importance of these issues. So one way of thinking about this, right, is to think about how oftentimes health organizations and groups might find themselves limited and deal with an array of challenges. If we think about, for example, the process of navigating insurance of navigating state and federal regulations, of navigating the needs of privacy, disclosure, and related issues, right? We know that oftentimes the challenge of navigating health and support is one that has a lot of red tape, has a lot of hoops, things to jump through in order to actually implement and create change. One example of this, again, is if we think about the Affordable Care Act in 2010, otherwise known as Obamacare, right? That was a major change in how health was provided, including the creation of what was known as an employer mandate that was then reversed and removed. So there were also a lot of discussions surrounding what was known as a public option in health insurance, right? Or a kind of public government-funded source of healthcare that would compete with other sources of healthcare on the market. Many of the other changes, including things such as allowing people to remain on a parent's health insurance plan for longer, are examples of some of those changes and reforms that we've seen, right? All that to say that the process of reform and change in the healthcare system takes a really long time. It involves a lot of loopholes and just a lot of bureaucratic red tape to navigate. But even within a healthcare provider or organization or group, such as a hospital or healthcare marketplace, right? There are a lot of challenges to deal with. One of them is a question of leadership. Who occupies a position of leadership in a health organization? How can that leadership create an environment in which people can effectively advocate for their consumers, for their patients, for anybody else? Also, this question of consumerism, right? Consumerism being this idea that we see market interest, we see a desire for people to pursue health information or products that we find appealing to ourselves. We talked about this a couple of weeks ago when we were talking about the prevalence of over-the-counter medications and the way that we oftentimes seek out those medications, the very consumerist approach. And then how can health providers move away from a lot of the red tape, bureaucratic challenges, and just the array of steps that can get in the way of providing quality care, right? Not to say that red tape or that bureaucracy is inherently a bad thing. There are oftentimes safeguards and measures in place for a reason. Just to say that there are a lot of ways that health and health information can be made a little bit more convenient. So in addition to that, we can continue to think about some of the ways in which organizations or groups are able to provide care. One of those is this idea of an integrated health center, right? So knowing that oftentimes it can be expensive to provide care for people, and also knowing that oftentimes people deal with the need to juggle between a lot of different providers or sources of support. For example, one person for mental health services, one person for general practicing, and so on. An integrated health center is something that we've seen over time that can provide a range of health services, basically to a single consumer. So those might be mental health, rehabilitation, nursing homes, and so on. One example of this is Oregon Integrated Health, which is an organization that provides a multitude of different services to people within its organizational structure. What I'd like you to do then is to take a little bit of time on your own or with a partner, if you don't have the device with you, to take a look at what some of the integrated health centers are in Oregon that you see, and to also take a look maybe in navigating their website, what types of health services these centers provide. So you don't need to turn this in for attendance, but I do want you to take a little bit of time to look through this, and then we'll jot down some notes about this together. So I'll let you take another minute or so to finish up. Okay, so I'd just like to hear some of the integrated health centers that came up as you all were searching, and then within those, what some of the things that were provided. So feel free to either just share verbally. You can also raise your hand if you'd like. What came up as you were looking? Yeah, Angela.
So I found Oregon, and they basically have 4 primary care clinics. One in Portland,
Uh-huh.
and then on their website it says that they provide telemedicine for primary care, mental health, and physical.
Uh-huh. Okay.
I also noticed on that one that it's same day appointments
Hmm.
and like everything actually same from like your contract with
Okay. What were other groups that you all noticed or examples? Yeah, JJ? Uh-huh. Any other groups that you all noticed you were looking through? Yeah, Tiana? Mhm. Those were the primary ones that I was noticing as well when I was doing a search earlier today to try to get to know some of these integrated health centers in the area, right? So these are examples, right, of a lot of organizations that recognize that there are a variety of services or needs that people might have. They also have experts that might have a level of background in multiple fields. For example, probably there's overlap in acupuncture and physical therapy and similar types of issues, right? So these integrated health centers are examples of how organization, structure, and so on are managing a variety of different types of care, right? And a lot of times in something like an integrated health center, there are a lot of unique concerns being pulled in a lot of directions based on the types of support and services that are being provided, right? We talked about how, especially over the past couple of years, the significance and level of discussion on mental health issues has gone up a lot, right? Especially related to COVID-19, although mental health has been a really significant issue prior. So there's been much more attention that these health centers have dedicated to those types of issues. And I wanted to share this just to highlight some of the ways that we see these practical things in action. Some of the ways that organizations manage and provide care in the context of a variety of current events and needs that people might have. So I think this is useful to help us think about organizations that you might consider reaching out to or learning a bit more about, and also some of the ways that health information is provided. So as we're thinking about health communication as it occurs in workplace and professional contexts, there's a couple ways to think about how these organizations can work efficiently and effectively, right? If we think about it, a lot of health organizations and groups are really concerned with how they can communicate and provide care in as efficient of a manner as possible. One of the biggest reasons being that efficiency means that people get care that's needed a lot sooner. Mental health, for instance, more patients can be supported. And if there's a mental health crisis or issue, that care can be provided more quickly. Sometimes, right, there is a market incentive to reduce costs and to allow an organization to continue to have their lights on. So it's this constant push. Oftentimes, health management organizations are more concerned with providing quality care than they are, of course, with making a profit. But although, despite those things, we see some challenges in navigating the sort of market maintenance with providing good care, right? One model and way of thinking about how to provide care is what's known as Six Sigma. And this relates to organizational communication and is essentially how a workplace routine or way a workplace is structured is understood, and how the value and contributions that people in the workplace can provide are compared to potential waste, errors, or issues that happen in a medical setting, right? So by defining the issues or topics, measuring and figuring out how an organization is providing care, analyzing, improving, and controlling, the cycle is a method by which a lot of organizations can provide better care. Another issue is to think about what's known as a workaround. We saw this especially in the context of COVID-19. When I got a test about 1.5 years ago, the COVID-19 testing facility was like a tiny little plastic shed in the middle of the parking lot, right? There were a lot of shortcuts and on-the-fly decisions and changes that needed to be made to adjust to a very different infrastructure and landscape, right? We all remember the great toilet paper crisis and the way that we had to respond to changes in demand related to COVID. And also this idea of a lean process map, where in kind of work and professional contexts, a lot of organizations are trying to minimize problems and to improve their communication. I wanted to share a little bit that talks about the Six Sigma and lean process, because I think both of those approaches help us to better understand how organizations can communicate and engage effectively.
Imagine you're the manager of a supermarket with customer dissatisfaction and attrition. These problems can be solved by incorporating two of the most popular quality management methodologies in the world, Lean and Six Sigma. One famous for its ability to handle waste, and another known for process improvement. But what if there was a methodology that combined the concepts of both Six Sigma and Lean? One that could solve all your issues? Well, there is Lean Six Sigma. Before we dive into Lean Six Sigma, let's take a closer look at its parent methodologies. First off, Lean is a methodology that focuses on providing value to the customer, eliminating waste, continuous improvement, reducing cycle time. Lean and Six Sigma both aim to handle waste. But what is this waste? Waste is any step or action in the process that a user does not gain any value from. In short, things that users wouldn't want to pay for. Why would a consumer want to pay extra for the additional truck that was required to deliver milk to the supermarket just because the other one broke down? This waste can be divided into 8 categories. Let's have a look at each of them. 1. Transportation. This waste refers to the excess movement of people, tools, inventory, equipment, and other components of a process than it is required. 2. Inventory. This waste occurs due to having more products and materials than required. This can cause damage and defects to products or materials, greater time for completion, inefficient allocation of capital, and so on. 3. Motion. This refers to the time and effort wasted due to unnecessary movement of people, equipment, or machinery. This could be sitting through inventory, double data entry, and so on. 4. Waiting. This can be time wasted waiting on information, instructions, materials, or equipment. 5. Overproduction. This is the waste created due to producing more products than required. 6. Overprocessing. It refers to more work, more components, or more steps in a product or service than required. 7. Defects. This is the waste originating from a product or service that fails to meet customer expectations. 8. Skills. This waste refers to the waste of human potential, underutilizing capabilities, and delegating tasks to people with inadequate training. For years now, many systems have emerged that use the lean methodology to identify and handle the different kinds of waste. Some of the more popular and effective ones are JIT, or just in time, 5S, and Kanban. The JIT methodology focuses on reducing the amount of time the production system takes to provide an output and the response time from suppliers to customers. 5S is another methodology that focuses on cleanliness in organization while improving profits and efficiency. Kanban is also another popular methodology to achieve lean. It is a visual method to manage tasks and workflows. Kanban enables users visualize the workflow to identify issues in the process and fix them.
You don't need to know all of the details of these subcategories and types of ways to reduce waste, but I did think that the video did a good job of talking about when we're making a health organization or group work more efficiently, what the idea of waste is and how waste can impact the effectiveness of an organization that provides support and services to people who need them. One really good example of this is masks for COVID-19, right? For instance, if a health organization or group is trying to supply masks and provide that as a service, there's been a lot of challenges related to production and amount of masks that are being given. There have been times where we've had a shortage of masks that are available. We've also received kind of updated information from the CDC and similar groups over time about what masks are considered effective, right? And what masks we would choose to have. For example, KN95 versus cloth masks that tended to be worn a lot more early on, right? So that can be one example. Access to COVID-19 testing kits and rapid kits, including the use of government funding and services to get access to testing kits are another example of some of the challenges we'll deal with. And also some of the waste and challenges related to expertise and personnel is something that we've noticed in the context of COVID-19 and current events too, right? In fact, a lot of healthcare workers have had to address staffing shortages by employing or putting people into shifts who don't necessarily have the level of training or qualifications that they would normally have, right? So there have been a lot of challenges related to those things too, that we can think about in how health organizations and groups are juggling issues of waste and trying to work efficiently. So, when thinking about how organizations such as those integrative centers that you all took some time to look at, or something like a hospital or other health organization works, in health, right, there is not a focus on profit, at least ideally. Obviously, a lot of health organizations and groups are going to have to continue to staff their workers and remain operational. And there are some that are exploitative in how they try to maximize profit, right? So there is still that concern. But I think a lot of health organizations differ in that their focus is not necessarily on making money, but instead on supporting people that need healthcare and need support. So that can be on people, principles, and this idea of sustainability that a health organization or group is able to persist and work effectively, right? So we might think about how typically, if we look at a pyramid, right, we have like a CEO or leader of a hospital, a health company, or group at the very top who's responsible for making decisions and has the power. But ideally, we think about this the opposite way, that a lot of the way that health organizations are structured and the way that they try to provide care is on this inverted pyramid, that patients and customers are sort of at the very top, right? They're the ones that are in top priority and receive the most focus and the most care. In other words, another way to think about this is when it comes to who should have power to make decisions that impact health and impact well-being, that should be on the customers, right? Or on the patients that are seeking healthcare. We can think back to this idea of patient-centered care that we talked about toward the beginning of class, right? That ideally, health providers are helping patients to make a decision. They're working as a team to provide information, but ultimately it's the patient who's making the decisions about their health. And in the same way, to whatever extent the decisions about health can be made by the patients is a good idea. And then you have the employees, right? Typically the frontline workers, the people that are directly providing care and support, who tend to have the sort of next level of priority, and are oftentimes the ones that have to make difficult calls or decisions on, for instance, providing pain management support, on making difficult decisions at end of life. We're often tasked with difficult decisions related to visitation in the context of COVID-19, which was a major issue. Then the idea that executive and kind of leadership teams are generally people who do not have the same level of authority or influence in the immediate day-to-day decisions that are impacting patients, right? If we think about it, if you're going to a hospital or a health center and you're trying to get care, you want your doctor to help you make a decision, and you want to make the decision yourself. You don't want like the CEO of your health organization to be the one that's making the decision for you. Maybe they step in when things have gone really badly, but you don't want them to be the authority and one with decision-making power. Another issue here to think about, right, is that the kind of further down you go, the less the individual has in terms of direct expertise and relationship to your health needs, right? You know your body, you understand a lot of your health issues, as do a lot of frontline workers and people that are working directly with you. But the idea here is that CEOs, leadership teams are not people that have that same on-the-ground experience, or maybe they used to and don't anymore. So they're generally speaking the last line to try to convey and talk about health information to. So this approach is how a lot of health organizations structure themselves and how they communicate and prioritize the needs of different people. There's also what is known as the Hoy-Tarter model of shared decision-making. And this is an important visual for us to think about how we can provide that really good quality health information. Again, good health communication works when patients feel empowered, when patients feel respected and supported, when they feel like they can make informed decisions, and they feel like their providers are able to participate as advocates and supporters of those decisions. Again, a lot of the disparities and problems that we've seen in the healthcare system have been in cases in which patients are not necessarily given that same decision-making authority or power. Maybe it's a health literacy barrier, or maybe it's doctors that are not respectful or supportive of patients' needs. So under this model, there's a couple key questions. Does a team member have a personal stake in the outcome, right? That is, does somebody like healthcare provider care about and really show a level of enthusiasm toward their patient, right? The further detached you are from that frontline worker, the less personal stake that they'll likely have. And then the second question being, does the team member or individual have expertise on the topic? Again, if you're at an integrated health center and you're seeking support for mental health, you ideally would talk to a therapist or mental health professional who'd be able to work with you rather than somebody who's part of a leadership team. So oftentimes organizations are hurt when the executives, right, who lack that type of on-the-ground frontline experience have to make those kind of frontline decisions, right? So one of the challenges is figuring out how to utilize that inverted pyramid, make sure that the person providing care is invested in the outcome and has the level of expertise and training that's needed. Again, in the context of COVID-19, in terms of shortages in frontline workers, nurses, and other qualified personnel, a lot has been really thrown into disarray about how we provide care and try to make that inverted pyramid be met. One, I think, important way to think about this, and also to think about how organizations providing healthcare and support communicate, is about understanding some of the theories of why they believe humans act the way that they do, right? If you've taken a class on small communication, you might be familiar with these contrasting approaches. So I'd like to touch on those a little bit. Depending on, from a leadership or manager perspective, the beliefs you have in your workers and how they act, you're going to reach different conclusions about how to make them and how to make the group work effectively, right? A key distinction here is what's known as theory X versus theory Y. Theory X is generally pessimistic about workers from a leadership perspective. Theory X says that people are lazy, they don't work hard, they're not effective, and that you have to essentially push or force people into situations that will cause them to be good at their jobs or to work effectively, right? Kind of picture it as just about everybody being like characters from The Office. Theory Y is the opposite, right? Theory Y argues that people are motivated, that inherently people want to do a good job and people want to work well in their position in providing care and support. And as a result, your job is to help to facilitate their motivation. There's also what's known as Theory Z, and Theory Z is kind of in the middle. It says that people do have interest and motivation to do well at work, but they need certain forms of support to get there, right? And depending on the attitude that you have about people, about workers in settings including healthcare, that's really going to impact how something is managed and organized. For example, an integrative health center is going to look really different depending on how it treats and assumes the behavior of its workers. Additionally, there are what's known as A and B players, right? We know that, for example, one of the greatest costs that can happen for a lot of healthcare organizations and groups is personnel cost and the cost of hiring and going through all of that, right? For example, if somebody is hired, typically there are benefits, moving expenses, and other costs that are provided immediately. If somebody has stepped down or has been fired, right, there is a process of recruiting and finding a suitable replacement. So the process of turnover and of hiring takes a really long time and it can be really expensive, right? I mentioned that my partner runs a nonprofit. One of the challenges he runs into is with case management, right? And turnover in case management and case workers is a major financial cost or obstacle. So an A player is somebody that we see as a positive team player. A B player is maybe somebody that is toxic or negative to the group, right? Thinking about kind of the cultural and group communication dynamic, the idea being that if somebody is really negative to the group, then it brings the whole group down, right? So we might think of examples, shows such as Grey's Anatomy, right, where the depiction of kind of toxic and negative characters on the show can really bring down the entire experience and quality of care for everybody. So it's important for a lot of providers to think about how their hiring practices work and how to recruit positive experiences with employees. One way to do this is what's known as the theory of causation, right? If you think about the idea of being kind of like a pawn that's pulled around and jerked around, like you are moving between facilities, you're commanded and told to do certain things, like, you know, you're working in mental health care and suddenly you get moved over to pain management with no explanation, right? When we feel disempowered and like we don't have any role of leadership or control over our own jobs or management in the organization, we tend to be less engaged, less interested, and feel a lot more frustration. So one way that we tend to have a better experience in healthcare and working in health-related fields is to feel like we can be actively involved and that we have decision-making power. There's also what's known as motivation hygiene theory. And this theory sounds a little bit confusing because hygiene in this context is actually not talking about like personal hygiene, like washing your hands. It's actually talking about hygiene as factors for an effective work climate or support, right? That is that there are motivators, right? Motivation followed by hygiene. Motivators are things that compel us to work and to do so effectively. Those might be job benefits. We know that in a lot of healthcare fields that there is good health insurance, there might be good retirement support, and other financial reasons to pursue that line of work. Or we see it as beneficial to our relationships. So there are motivators that compel us, but we also have what are known as hygiene factors. Example, not receiving good pay, being in a potentially hazardous work environment, and those types of issues can really wear down and mean that for a lot of people who work in areas like healthcare, that they're having a much more negative experience. I wanted to share a little bit of perspective here related to frontline workers in the context of COVID-19, right? We've heard a lot about some of the challenges and experiences of frontline workers and the ways that the sort of longer term impacts, not only of COVID-19 and risk of exposure, but also of kind of the social and psychological impacts of the work shifts, of the labor involved in care and support, can really kind of have this detrimental effect over time and have caused significant quantities of burnout and turnover of people involved in healthcare. So I wanted to share a video that identifies some perspectives and experiences that I think relate to some unique challenges related to healthcare and support.
So, anything before, from the moment you set foot into Humber River Hospital, in the emergency department, and throughout the intensive care unit, and then connected straight to the signs. These are extraordinary times, and they call for previously unimaginable measures. These nurses are being reminded how to handle the bodies of those who have succumbed to COVID-19. Just label it COVID, she tells them.
When we came up, our first patient, I think we were unsure of, what the outcome was going to be.
The first COVID patient to be intubated at Humber River Hospital is this 51-year-old man. He presented with typical respiratory symptoms, but for how long he remains on a ventilator, no one knows.
We have not had an early extubation like that on a ventilator, so
None.
none. Yeah,
So as soon as they're intubated, we just remain with breathing tube for however long.
so patient number one is still intubated, and that was a month ago.
Right now, he is stable.
I think the fact that as a team, we're able to make sure that he's stable, he's cared for, and his family's updated on a regular basis. I think that for us are the biggest wins.
Another symptom of the COVID-19 crisis in hospitals, no visitors allowed. For the patients in the ICU, that means the prospect of spending their final moments isolated from loved ones, and that takes a toll on everyone.
And a lot of these folks are dying alone with our nurses, myself, our doctors, being in the bedside with them. As the video recording these end of life moments. And that's the most distressing because we as a society are scared of dying, and to die alone is one of our most fearful moments.
COVID-19 is a silent killer. As we showed you in the first part of this series, while being intubated, this woman lost a pulse for at least 10 seconds.
Was there a sense at one point that, she could have died? There was a sense. She did lose a pulse. We did have to do chest compressions. And yeah, that did happen. It is scary. It is sad. Yeah, it is.
They put on layers of PPE as they prepare to battle the enemy. But global shortages present unique challenges.
And we do have significant shortages in that and drugs to sedate and prepare our patients for the world shortage, and also in the PPE.
Every
So this hospital is located in Toronto, and this video came out, I believe, in April of 2020, right, when things were really taking off with COVID-19 in North America. So again, helping us to start to identify some of the ways that health communication has been really impacted in the context of COVID and similar issues, right? Again, this idea that, for instance, a lot of frontline and healthcare workers have felt some of the unique psychological impacts, like the one who was talking about how they couldn't necessarily, or like they had to isolate people at end of life who weren't able to see family, which of course would be really challenging both for that person, but also for healthcare workers who are in that situation. The example of labeling somebody who had died of COVID, like and putting the label COVID on them, right? There have been a lot of really major challenges with personnel and resources, and in just kind of navigating that have definitely created some increased challenges and what we could consider to be hygiene factors that have made the process of providing care and support a lot different. So again, while there are a lot of people that have worked very hard and done an amazing job in providing support and care in this really challenging time, I think it's really important to put into context some of the impacts of that type of care and some of the challenges that healthcare workers have found themselves in both an individual and organizational context, thinking about COVID and related issues. So we're at about 2:50. So I'd like to take about 10 minutes to give you a bit of a break, use the restroom, get a snack, whatever you'd like. We will continue where we left off right after this. And we'll be talking a little bit more about culture, some of the ways that culture connects to how we can create a positive environment for people involved in the healthcare field.
I'm pretty sure that, and she even said after the term process. I didn't, that one I actually watched all of it. The ending was, like, they held it down. Yeah. Yeah, they probably. I think it was, like, I. It's not like.
All right, so let's go ahead and chat a little bit more about this. I know some of the stuff can be a little bit dry, but I do think it's helpful to understand some of the ways that health organizations behave and also the ways that we communicate about health in a lot of these settings, knowing that some of you might be working there or also gaining context about how these types of groups work. So when we think about creating good relationships, right, we think about the best places that we work or the best kind of collaborative opportunities we have, whether it's in school, college, so on, right? There are a lot of different elements that go into making us have a really positive experience. For example, when I've been involved in speech and debate, having a team where we really work together and create a good relationship with each other has really been a really big factor in things going well. One idea here is what's known as the commitment trust theory, which is the idea that people will make decisions on the basis of trust that they have toward other people, right? That trust is tied to commitment, our investment in other people, and that when we trust those around us, we're a lot more comfortable behaving and acting effectively as part of a group that might be involved in healthcare and related issues, right? This idea being that for a health organization, creating trust and camaraderie amongst workers is a crucial way to help that organization work effectively. The trust predicts the strength of a relationship, right? In other words, having things such as training, mentorship, roles that might be involving an intern or temporary role, providing those opportunities for healthcare workers to develop culture and to work together effectively is crucial, right? This idea that culture is developed within healthcare organizations or groups, right? We think about a lot of the demands of healthcare workers and their grueling hours. They're oftentimes very odd hours and oftentimes involve having to juggle a ton of different demands. So especially in sectors like healthcare, creating a good culture, creating a sense of camaraderie and collaboration is crucial. In fact, a lot of healthcare workers say that the ability to form good relationships and culture within their group is a big factor in whether they choose to remain in that field, right? Culture is also formed in relationships on the basis of things such as cultural difference. For example, one measure of cultural difference is this idea of power distance. In lower power distance, somebody like a supervisor, like a doctor, is somebody that a healthcare worker is more willing to directly communicate with and talk to openly. But depending on the culture of the organization or group, higher power distance means that an authority or expert is somebody that's talked to less frequently, and when they're talked to, and it's in a much more formal capacity, right? So those types of relationships are really crucial for cultures to develop within healthcare fields. So using some of the things that we've talked about so far for today, what I'd like you to do is to take some time in smaller groups to address the scenario. So we've taken some time to talk about integrated health centers. I've had you all look into some of those. And let's pretend that you and the members of your group have actually developed a new integrated health center in LaGrange. And what I want your group to think about as part of the scenario is to think about, first of all, some of the things that you would need to do in order to create a positive workplace culture for members of that health center and workers that you'd be engaging with. Second of all, we've talked about human behavior and motivation. What are the theories that you all would choose to approach? For example, are you more into theory X or theory Y, about why people act the way that they do in organizations? And then lastly, we've talked about how to make organizations and groups efficient through things like Six Sigma and Lean process. How might that assist your integrated health center as well? So take some time to talk about some of these ideas and the ways that your integrated health center could communicate and work effectively. We've got, looks like 12 people here today, so we'll do 3 groups of 4. So we'll do 1, 2, 3, and 4 on these rows. We'll do 1, 2, 3, and 4. Then 1, 2, 3, and 4. So take some time to chat about this and start to work through some of these ideas on how you might work in this integrated health center. About 4 more minutes, then you can take with us. Take another minute or two to finish up and have somebody ready to share. So I was hearing some really good points from groups here talking about sort of managing the demands and these challenges of maintaining a good workplace culture and all of the issues that would be related to creating a new health center in the grant. So let's start here with this group on that first question. What do you all think about as necessary steps for creating a good, positive workplace culture?
So it's a cultural competence training and an employee empowerment model. Use like the reverse pyramid model, especially to make sure frontline workers are always heard, like they're in the know, and that they always get a say in decisions themselves, because mostly dealing with things on the more daily basis.
Right, right. You know, as you all brought up, right, frontline workers, because they're doing those day-to-day tasks to really maintain the care and support for people, like the idea that they have some power and say over the decisions in providing care and support for people. So that can be a really big element there, right? We talked a lot about patient empowerment in our health communication, but we can also think about empowerment for workers, including frontline workers, in how an organization is managed and structured such that people that are most directly providing care really feel like that they are able to do so to the best of their ability without feeling like their hands are tied. Let's hear from the group here in the back on the second question. What were some of the theories of behavior and motivation that you all noticed as persuasive that might impact your organization? Right. Yeah. That's great. And, you know, Kiana, as you and your group kind of identified, something like cultural awareness training and similar like professionalism training and similar measures, right, are ways that organizations can work to reduce health disparities. Because a lot of times, assuming health literacy on issues that people might not know much about, or assuming sort of that language or cultural barriers don't exist can be a big reason that we see these disparities and impacts. So really working on training workers and providing support to address those can really do a whole lot. And then here in the front, what did you all think about in regards to Six Sigma and a lean process?
Since Six Sigma can help you create like a set procedure list, like in order to make decisions like efficiently and effectively.
Mhm.
And that way it like reduces finger pointing and makes you an example of like when people need to be put on the transplant list, that can
Right.
be like heartbreaking for some people, but instead of it being like, you don't want to give me this, like this is your fault, it's I'm sorry, we follow procedures, it's not my fault, you need to be perfect. So that kind of avoids some of those issues. And helps people.
Right, right. Having a system in place for dealing with issues like that can be a really good way to help the organization or group run effectively, right? And I think that there's like a maybe callous or detached way, at worst, we could think about like Six Sigma or Lean process that's like, well, a health organization is going to try to make money. But when we think about it practically, when there are a ton of patients coming in, especially an influx of patients with COVID-19, right? We've seen in a lot of hospitals that they've been at or beyond capacity. There's been really limited access to things like hospital beds and other support, right? The question of how efficiently a hospital or health center runs is oftentimes a question of how many lives they can save, right? And how many people they're able to support. And obviously, rationing care is not something we want to see, but it has, in a lot of contexts, come to that or close to that for a lot of workers. So allowing an organization to function efficiently is a way to really make sure that they're maximizing the care and support that they need. So I really appreciate each group here talking about some of these ideas and helping us to think about how we can provide better care. I'm going to have you return to a group for part 2 in a minute, but I do want to talk about a few more things before we get there. So we have spent a lot of time talking about organizations, right, and how an organization or health center works and builds positive communication amongst its workforce. But I also want to talk about how organizations are communicating to the broader public and group of people, right? Because if a health center or health provider or organization is not seen as credible or reliable or supportive, then we're likely not going to pursue them. For example, right, if we think about OHSU, OHSU is pretty well known in the state of Oregon as a provider of healthcare, right? It has the, if you have been in Portland, it has the lift that you can take where you're actually like kind of like a gondola, you're up in the air and you can take that to OHSU, right? So it's well known within the state as being a fairly credible healthcare provider. Two-way symmetrical communication is what is known as an individual or organization and a larger public, right? It's about the sort of public image and way in which these groups and providers of care and support are able to communicate to the public. And this question of credibility and reliability is crucial, right? If a health center or hospital is not seen as credible or able to provide quality care, then not only are people not going to show up, but there's also going to be less trust within the organization in terms of how care is provided and how recommendations are given, right? If you're going to see a doctor who is not well reviewed, you're less likely to believe or trust in what they are proposing as medical options. So in this way, what is considered to be the greatest predictor of an organization's success is what is known as both its character and the consistency of its reputation, right? In other words, character is what we might associate with its integrity or beliefs or behavior that the organization does. For instance, maybe this hospital was on the front lines, really able to provide good quality care. And consistency is important too, right? In fact, we know, thinking like to classical conditioning, a rat pushes a button and gets a snack, right? We know that rats are actually more motivated to push the button long term if they know that they don't get a treat every time, but they get it sometimes. In the same way, we have a lot more concern about an organization or group that's not reliable, where sometimes maybe an organization provides good care, sometimes it doesn't, and we have heightened concern if we know that it's a little bit of a gamble, right? So health organizations and groups really see providing consistent quality support as crucial. I'll give you another example. If we think about food recalls, right? For example, maybe something like kale or spinach has been recalled because there's something like E. coli or salmonella outbreak, right? Oftentimes, the organization or provider of that food takes a huge financial hit that's much greater than the actual recall of the product. It's based on the public perception and this sort of public fear that emerges as a result of maybe a small selection of their food being recalled, right? Another example, right, is the Mexican food chain Chipotle similarly has dealt with recalls and a lot of dwindling support and probably backlash related to recall, even if it didn't actually impact a consumer, or even if the consumer wasn't at risk, right? We associate the risk with that organization. Corporate identity, right, is what makes an organization or group especially recognizable, right? You could think about something like the Pepsi logo. We could think about like the sort of iconic OHSU building, if you've been up in Portland to see it, right? There are a lot of specific ways the imagery, iconography, slogans, and catchphrases can really make an organization well known. Image, right, is our feeling about its personality or structure, right? And we make an evaluation of reputation in terms of how this organization has behaved in the longer term. If we think back to the history of health and science, we think back to the Flexner report, right? The Flexner report found that a lot of health and science organizations around the turn of the century and industrial revolution were not very credible or were not providing very good care, right? The exceptions, and many of maybe the medical research centers that we now think about as being especially credible or good, for example, Johns Hopkins or St. Jude's, right, are examples of medical centers and facilities that have gained a really significant reputation and a lot of credibility over time, right? So reputation has to be connected to action. To maintain a reputation or positive association with a health center or group, they need to continue to act and to respond to changing circumstances, right? You go to a health center and they have no sort of action or awareness of COVID-19, you might be concerned that they haven't adapted to changing circumstances, right? So a lot of health organizations have had to adapt in providing care and support. So this kind of brings us to thinking about public relations and reputation, right? Public relations is actually a new program. So if you are sophomore or junior, we are actually starting some new courses in public relations next year. We'll have a new faculty member who will be leading the charge on those. So it's definitely an area to focus on if it's interesting to you. Public relations, of course, dealing with the ways in which members of an organization or group communicate to the broader public about issues. And there's a lot of concerns as it relates to health. For example, we might think about the CDC, Centers for Disease Control and Prevention in the United States, and the way that they use public campaigns related to COVID-19, related to a variety of issues. Here is one as part of their PR public campaign about how to properly use hand sanitizer, right? So one of the ways to manage reputation and public relations is to continue to use and be interactive with social media, right? If you are on Twitter, a lot of companies like Wendy's will use like very humorous and kind of snarky social media activity that's been a part of their brand, right? Using social media, communicating through social media is now basically essential for an organization, including one that provides health services, especially to reach people instantaneously. Linking messages to key services, right? So perhaps maybe a health organization is providing free masks or free test kits. Being educational, remember that the goal of a lot of health organizations and groups is not to make a profit, but to educate and support the public, right? We've talked about communicating and some of the challenges of communicating to the public. So providing accurate, correct information is important. Using a range of channels is really good too, especially if we think about things generationally, in terms of what's known as the digital divide, some of the tech barriers that we've encountered. It was brought up earlier in the class that in encountering some tech barriers and related issues, using things like paper flyers, bulletin boards, and other information where things are provided face-to-face is a way to use a range of communication so that everybody is supported. Updating people during a crisis, right? This has been incredibly important in the context of COVID-19, especially as things were just starting. We had a lot of unawareness about the virus and how it worked. And we've seen this, especially in the context of new variants, and a lot of concern about how much fear or concern we should attribute to a particular variant, right? There's also what's known as the worried well. That is somebody that's not impacted or hurt directly by a particular health issue, but is worried that it could pose a risk to them, right? So, for example, I took a test this morning, I tested negative, but of course I'm still concerned about how cases are going and possible risk, right? Maintaining relationships is important. A lot of organizations and groups in health are going to continue to try to have good relationships with their patients, also with other organizations or groups that they might be collaborating with. Social media policy is a good idea too, especially as we think about, and as Kiana's mentioned, right, the idea of maintaining professional and effective communication and behavior, right? A lot of roles in healthcare might even involve managing and navigating social media presence and doing so in a way that is professional and accurate and correctly reflects the needs and concerns of an organization. How many people are familiar with this or know what this is, this image?
Oil spill in the world.
Yes, this is the Deepwater Horizon spill, right? You might be familiar with it as the big BP oil spill, right? And that was huge because you had a ton of oil that was leaking and flowing into and polluting the ocean. They even made a movie about it with Mark Wahlberg, which I have not seen. But, right, one thing to think about too in issues of health is this idea of crisis communication. So if a huge crisis or challenge emerges, for example, an oil spill, or maybe a huge public health crisis, as we have noticed with COVID-19, right? It's a major occurrence or issue that has negative outcomes that can affect an organization and its reputation, right? And in many ways, for a lot of organizations and groups, this is the make or break for a lot of them, right? If an organization has totally botched a crisis, mishandled a crisis, or managed it very poorly, we see that oftentimes they'll go under or have your reputation severely harmed. The BP oil spill was not just a major disaster in terms of its natural resources and, of course, the impact on the environment. It was also a major disaster from a public relations standpoint. It was poorly communicated, poorly handled. The CEO of BP, Tony Hayward, was not taking it seriously or even coming to visit the site until much later, and when he did, was in many ways downplaying the crisis, right? That's an example of what not to do. Crisis management means that if something were to come up, that you communicate with everybody, including the larger public, to manage and to deal with the situation as it's happening. So here's Tony Hayward on the Gulf, getting a lot of questions and, of course, a lot of blowback for how BP chose to handle this issue. So when it comes to dealing with a crisis or issue that has come up in health, it could be a major breach or outbreak of COVID-19 or just a major issue or scandal or problem that happened. There's a lot of things that an organization can do, right? If you have seen the Shondaland TV show Scandal, every episode is crisis communication, right? Addressing and fixing the problem immediately, of course, is the top priority. There's an oil spill, you close it up. There's an outbreak, you close things down, you get people who are tested positive and quarantine and so on, right? Using a failure as a springboard for improvement is another important element of good public relations and communication, right? To say, we've listened, we've learned, and we've improved and addressed this issue in response to those concerns is important. Honoring the sacrifices and challenges, right? So again, we've looked at a lot of healthcare and frontline workers. We also know, like in a lot of kind of major stories about heroic moments and challenges, that those issues are seen really highly. For example, when we had the Chilean miners, right, who were trapped, that was a story that was very popularly circulated and shared, making people feel especially satisfied in a moment of crisis. If an organization is really acting in a super responsive and responsible way and really clear, that can drastically improve the outlook of an organization, right? If they're on the ground and providing like test kits, masks, and other methods of support, that could be an especially useful way that an organization can do well. And also just to stay motivated and to maintain a good organization, right? Again, a lot of groups involved in healthcare are going to encounter major crises, problems, and issues that could impact them and impact their future. So thinking about managing that communication in those situations is important. So what I want you to do is to return to the groups that you were working with before, and using that same sheet or work you were typing, I want you as part 2 to imagine that your integrated health center has suffered a significant outbreak of COVID-19 that's left many of its healthcare workers sick and many of its customers who are worried about possible exposure. What I want you to think about first is how your health center might address the public on this issue and communicate with the public about this issue, and how your health center might work on creating and maintaining public trust. To talk a little bit about that as well. So how might you incorporate some of those methods of crisis communication for your center to respond to that issue? So go ahead and return to your groups to talk a little bit about this. take about 2 or 3 more minutes. So take just a second to finish your thoughts here. So let's hear from the group at the back here about how you would address the public, you know, if this were to come up in your health center.
Number 1 or 2?
Number 1.
So we wanted to do a massive posting on social media as well as the messages that we wanted to put out. We definitely want to do a public apology, and so throughout our also wanted to do some educational factors in there as well as like recommendations on places to get
Yeah, a lot of times organizations and groups like this one have like a message or email system where they can send like an immediate message, almost like an Amber Alert, right, in case of crisis, and having that type of infrastructure established really helps, even if it never gets used, right, for people to feel like they can easily be contacted immediately. I also know that some states have included a feature like on a smartphone where it lets you know if you were in possible exposure. How about here in the front? What did you all say to this first question about addressing the problem?
You said to make sure we keep everyone informed, like be as transparent as possible, and just like the first group, send messages through like all platforms that you can, because often everyone does have social media, but also email, creating flyers, maybe like spreading word to schools, and like in case for those people that do have appointments coming up at the beginning of the outbreak, make sure you give them options and encouraging choice. Like you guys came from me, but you can wear a mask, you don't have to come in, there's no penalty for canceling. You can talk to you via Zoom and just make them as comfortable as possible.
Yeah. Izzy, I like the way you incorporate those elements of telehealth and the ways that those can be used to address those barriers as well, right? And then in terms of public trust, what did you all on this side think about managing that?
We said getting on top of this and misinformation, and then organizing both formal and informal events, conferences with both news outlets and normal people like on social media stuff to And having like sections on websites directly related to campaign or something, so just like making sure all the information is proper and somewhere.
Yeah, right. So managing this and disinformation, we're talking earlier in the term about the distinction between those two, question of whether it's intentional or not, right? We know from our experiences before, or maybe during college, that rumors spread very quickly, especially if there's not like a direct official response to a thing. You might be thinking, oh, well, I heard that somebody caught COVID but chose to come in anyway, right? Rumors and misinformation can spread so quickly that acting fast and really communicating what happened in an official capacity is an important element of public trust, right? And sometimes that might mean identifying why that issue happened. For example, maybe you said that we didn't really have a method to test, to have people complete regular tests, but now we're going to require workers to do a daily test and test negative before they come into work, right? Or, we have the EOU daily health check thing. That would be another example of how organizations or groups can manage and create methods to try to encourage public trust on those types of issues. So good work here in thinking about how your response needs to be direct, needs to be fast, and engage well on those types of issues. Again, public relations isn't my area, but we do have some courses focused on public relations we'll be offering next year that are really great if this is an area that's interesting to you. So to wrap up the key ideas at this point, I talked a little bit about the campaign essay, and again, I'll be posting a little bit more about that later this week. It's not for a while, but you might want to start thinking about a possible campaign that promotes health issues that you're interested in exploring. We talked a little bit about some health policy issues and why health policy is important, right? It has a lot of social and cultural implications. And we look specifically at how health organizations and groups are structured, their culture, and the ways that they can manage a relationship with the public. We'll be spending some time next class talking a bit more about health crises and issues related to healthcare reform, including some case studies and examples here on how to promote health and related issues. So please make sure that all of your group members have your names on your work for today. Please email or pass that forward. Have a great Monday and rest of your week. And I will see you all again for Wednesday's class.